Hey everybody, thanks for joining me, Dr. Ross Marcagiani, with another great word of the week. Today we're going to be talking about hypothyroidism, and we'll be talking about what the thyroid is really quickly. We'll be talking signs of hypothyroidism, how we want to test for hypothyroidism, and then how we optimize the thyroid. Let's dive in. So I'm going to try to go cursory overview here and not go as lengthy as I usually do. So we're not going to dive into the stringent details, which I like. Maybe we'll have that for another conversation. But the thyroid here, what we want to think of is it's a little bow tie-like gland over the throat, as you can see in this picture. But it's the thermostat of the body. So that means it helps to regulate body temperature, and it helps to regulate resting metabolic rate here. And it does a lot more. It helps to obviously regulate bone quality and bone density. It has a huge factor in the immune system, and it also is tied into the adrenal system or the adrenal glands, which in previous conversations people have probably seen how we've talked about the HPA, the hypothalamic pituitary axis, and the HPT, the hypothalamic pituitary adrenal axis. The HPT, that's the thyroid, and then the HPA, that's the adrenal axis, how they're tied together there. So realize that it's just more than just the thermostat. The thyroid is tied into a lot of important mechanistic actions in the body. And then also the signaling of the thyroid. So we first start with thyrotropin releasing hormone, TRH, that starts in the hypothalamus, and then the signal gets sent to the anterior pituitary where TSH is released. A lot of people know that marker. That's your thyroid stimulating hormone. And then the gland will then produce T4 and then T3. So thyroxine and triiodothyronine. So those are the forms of hormones that's actually produced, and it's our T4, which is the most inactive, then gets basically deionized, removes iodine, and we produce our most active thyroid hormone, which is T3, that triiodothyronine. But what are our common symptoms here to look for if you're wondering if you have hypothyroidism? So you can see the list here of lengthy symptoms. Couple ones that I want to just highlight. Obviously the fatigue, the depression, the memory loss, the weight gain, the hair loss. Those are real big issues. Then we get down here, you can see menstrual issues such as amenorrhea, lacking or not having a menstrual cycle. Oligomenorrhea, where your menstrual cycle is very inconsistent, skipping around a lot. And even in some cases, menorrhagia, when we're having excessive bleeding, or the 28, 29, 30-day cycle has been shortened into a 23, 24-day cycle. And then you can see decreased libido, muscle aches, headaches. A really nice way to also look at some, to kind of track this to see as well, as you can do a deep axillary body temp. So you take take a thermometer, place it in the armpit, and you can take a body temp of your axilla, and it should be typically above 97.8 degrees. You're going to take it first thing in the morning before you get moving, and you take it 5 days consecutively. Again, it should be above that 97.8. If it's starting to drop consistently below that, that could be an indication of an early indication of hypothyroidism or a sluggish thyroid. Some physical signs you can do, these are mainly for the physicians: a deep tendon or a lack of deep tendon reflex in the Achilles tendon, keratoderma, which is just yellowing of the skin, mainly on like the palm of your hand or the soles of your feet. And then we can see basically hyperkeratosis or keratosis pilaris, where you get the little raised bumps on the back of your arm. That kind of looks like goosebumps, but it's just in the back of your arm in the tricep area. Also dry skin, coarse hair. Those are some other signs there. But the body temp is a nice way to evaluate that. And then what we want to test for. Now, typically, most physicians will just run your TSH, their thyroid stimulating hormone. We want to look at your total T3, your total T4, your free T4, your free T3, your TSH, your reverse T3. We want to look at your thyroid antibodies, whether it's If it is hypothyroid, meaning the thyroid is underactive, we want to make sure we look at the antibodies associated with that, which could indicate Hashimoto's, which is another conversation. But that's your thyroglobulin antibody and your thyroid peroxidase antibody. We also want to look at your T3 uptake, the importance of iodine we want to look at. We want to make sure we look at vitamin D, your glutathione, your CoQ10. These are all vitamins that help support the thyroid here. We talked about taking that basal metabolic temp. Remember, 97.8 or above. If we start dropping around 97.3 on average, that's some early indication to potential hypothyroidism. We also can look at your ACTH, your adrenocorticotropic hormone, more regulated with the adrenal glands, but it's an indication, if the adrenal glands are off, it could be affecting the thyroid and vice versa. So that's looking at pregnenolone, cortisol, DHEA. Again, these are other adrenal hormones. So we just want to be aware of those when testing. And we may have subclinical hypothyroidism, meaning your TSH is a little off and everything else is normal. And there's also even sub-laboratory hypothyroidism, which means basically your testing looks pretty good, but you're showing all of the signs or symptoms which could be indicative of trying to give some support to the adrenal glands or the thyroid. So that's something to take note of. And then you could also have something. It's a little bit on the rare side, but there are genetic conditions where the tissue is actually resistant to medication. So that's something that you could do genetic testing, but that would be much further down. So how do we optimize your thyroid here? So first we want to make sure we have adequate testing done. That's priority number one. We want to make sure, second priority is we have good nutrition, healthy nutrition, low inflammatory diet, high and rich in good antioxidants, staying away from, again, excessive amounts of gluten, our dairy, and our sugar. But how we would want to optimize is using some type of desiccated thyroid. I like using ecothyroid, either 37 or 125, but you can get prescription-based forms such as your Armour, your Nature Throid, your WP Throid. These are desiccated forms. But you want to be careful here because depending on what your blood work comes back, Armour is more related to increasing your T4, and then another hormone such as like your tyrosine or even cytomel, which helps to increase your T3. So there are different medications you can use to increase different amounts of the thyroid, whether it be T4 or T3. But again, I like using the natural ecothyroid, which is over the counter, and it helps really, really well. Also, we want to make sure we look at your iodine, but I put an asterisk around this because as we increase your iodine, if you do have those thyroid antibodies, or if you do have antibodies, iodine can increase those antibodies. So you always want to make sure you monitor that. And then making sure we can use glutathione, CoQ10, L-carnitine. These are things that help to increase the function of the thyroid. And then we want to make sure that the adrenals are working well. If not, giving some adrenal support, whether it be some pregnenolone, whether it be glycyrrhiza or licorice root to help increase the cortisol, or looking at other adaptogenic herbs, ashwagandha, rhodiola, ginseng, these other herbs that help to optimize the thyroid and therefore will enhance that will optimize the adrenal glands, which will enhance the thyroid. So if you're someone who's having these symptoms or want to take a deeper look into your thyroid, start with that basal metabolic or the axillary temperature and get some blood work done. If you have any questions, please don't hesitate to reach out. Let me know if you have any issues. And if you know anyone that this sounds like an individual that you know, please share this information. We're all in this to get healthier and happier. Thank you for your time and have a wonderful day.